In the past two videos, we discussed the causes of patellar tendinopathy and the equipment we can use for our lower body. Now we'll look at the exercises, methods, and principles to treat patellar tendinopathy or PT. The goal for treating PT is to 1. Decrease pain, 2. Increase strength, and 3. Restore or improve fencing performance. So to rehab PT or jumper's knee, there's a 4-stage progression that one should follow. Stage 1, isometrics. Stage 2, lifting/isotonics. Stage 3, jumping/plyometrics. And Stage 4, fencing sport. If you experience pain within a certain stage, then go down to the next stage. For example, if you have pain during fencing, which people with PT will, then stop fencing and try a plyometrics program. If that hurts, then stop plyometric and try lifting with isotonics. If that still hurts, then you can start with isometrics. Isometrics are exercises where the muscle continually contracts, but there's no joint or limb movement, meaning you're just holding the position and there's very little stress on the patellar tendon. Almost everyone with PT should be able to perform isometrics pain-free while gaining strength in their quads and their patellar tendon. Using the equipment we talked about in the last video, we can perform the split squat isometric. You should load the exercise heavy enough to work 30 to 45 seconds until failure. Do this for 3 to 5 sets on both legs, resting 2 minutes between sets. Since this places little stress on the patellar tendon, you can do these as frequently as possible, up to twice daily. If you don't have access to this equipment, you can still perform this using just your body weight, still keeping it to failure. And if you have access to the leg press and leg extension machines, those have also shown to be highly effective to load the quads and tendons. After a few weeks of isometrics where pain has stayed below 3 out of 10 intensity, then you can move on to stage 2 and introduce isotonic exercises to your loading program. Isotonics consist of concentric and eccentric portions of a movement. They should be programmed to increase strength around your hips, knees, and ankles. Exercises that target the quads include squat variations, split squats, leg extensions, and leg press. To target the glutes and hamstrings, you can do different type of deadlift variations. And for the ankles, you can do seated and standing calf raises. At first, start with a higher volume at an easier weight to improve form and gain familiarity with the movement. You can start with 3 to 4 sets of 15 reps with 2 minutes of rest between each set. Once the weight becomes heavy enough, you can reduce the volume to 6 reps per set. You should try to do these exercises every other day, allowing for enough recovery between sessions. After a couple weeks of lifting, you can gradually introduce plyometrics. Jumping and other plyometric exercises are done to expose the tendons to elastic contacts, which are similar to sport. Plyometrics such as pogo jumps, bounding, and hopping are great ways to increase the load tolerance of your tendons. Start with a lower amount of reps and slowly increase both the volume and intensity. Along the loading program, you should try to go to fencing practice in between lifting days to maintain your technique. However, make sure that all movements should be close to pain-free, and you can gradually increase the volume and intensity. Try to do a little bit more each practice, such as more footwork, a longer lunge, or a deeper en garde. You can also increase the amount of days that you go to practice each week. Week by week, you should be progressively overloading your lifts, gradually adding a weight or intensity to each exercise. This makes sure that you're consistently getting a high stimulus and a positive adaptation. It's very important to make sure that your pain stays at or below an intensity of 3 out of 10 after each session. If you feel that your pain has increased the day after a session, then you have induced too much stress on the patellar tendon, and you need to cut back the volume and the load. Before each lifting session, make sure to warm up properly by dynamic stretching and try to get more blood flow to your legs. Also, make sure to form the habit of stretching thoroughly daily. Stretching improves flexibility, relaxes the muscle, and acts as a cool down after exercise. Eventually, as your PT improves, you should be able to lunge and fence with full effort pain-free. However, this can take upwards of weeks or even months. While fully curing PT may seem like a daunting task, it's very achievable if you try to stay consistent and get better day by day. Thank you for watching the video, and I hope you learned something about treating patellar tendinopathy. Please leave any questions in the comments and share with anyone who is struggling with knee pain.